Hi, my name is Abby James, and this is my presentation for the One Health, One Medicine presentation. Today I'll be presenting on dengue. So the background on this, it's a human arboreal virus, which means it spreads from arthropod vector to humans. There are four serotypes. It infects about 50 to 100 million persons every year. There's three different types. There's the dengue fever, dengue hemorrhagic fever, and the dengue shock syndrome. Once you're infected with one serotype, you get immunity for life. But once you get another serotype, then you're more likely to get the hemorrhagic fever or the shock syndrome. Then we want to discuss epidemic versus hyperendemic. Epidemic is where you have one serotype outbreaking in one region, and hyperendemic is when you have more than one serotype in a hyperendemic region. So the transmission is between mosquito and man, as we said before. So once the mosquito bites an infected man, it lives in the mosquito intestines for 10 days, then it goes to the salivary gland and it infects the other person, and the mosquito is infected for the 30 days of its life. Then we've also discovered vertical transmission. So if a mother has dengue fever, she can pass it through the placenta to her newborn baby. Symptoms and signs: usually there's a prodromal period of 2 to 3 days with chills, facial flushing, and red mottling of the skin. You get severe fever, bone pain, joint pain, muscle pains, and it gives the nickname breakbone fever. You also get retroorbital pain and a biphasic rash that starts during the fever period, and then another rash that starts after the fever period, and you can sometimes get red spots on your skin as well. So the most specific diagnosis for these would be isolation of either the virus itself, virus antigens, or a rise in antibody titers to the virus itself. Then the less specific ones that are indicative of the dengue virus would be CBC counts, where you're looking at low white blood cell counts, low platelets, low sodium. Coagulation studies, we're looking at clotting factors. It's usually prolonged clotting time. And ultrasonography, because once you find a thickened gallbladder, that usually precedes any damage to the blood vessels that would precede the hemorrhagic fever. The high-risk groups would be pregnant women, people who are under 15 years old, and first-time travelers to endemic areas would be at risk for dengue fever. Persons who live in the endemic areas or people with a prior infection will be at a higher risk of the hemorrhagic fever or the shock syndrome, because they would have already had antibodies to at least one serotype. So prevention strategies: these are day-biting mosquitoes, so mosquito netting is not really advised. But when you go out during the day, do use DEET repellents, wear well-covered clothing, and reduction of breathing spaces using larvicides, and covering of water spaces, and a lot of public health surveillance and public education. So if you have a patient that comes in with dengue fever, care is primarily supportive with fluid replacement, pain reducers, and fever reducers, and you'd want to use acetaminophen only. NSAIDs such as aspirin would further prolong your bleeding time. It's already a hemorrhagic syndrome. So thank you very much for your time.